Hi, my name is Karen Tam. I'm a registered nurse. I work for Area 1 BOCES, and I'm a nursing instructor for a high school program. And today I'm going to talk about and demonstrate how you make a closed bed. Before I start the skill, as you would in any skill, you would wash your hands. I will now wash my hands for 20 seconds and I will be back with my linen. I have my linen, and my linen is in order as I'm going to put it on the bed. My first item is the bed pad. I'm setting my linen on a clean surface, which is the patient's nightstand. I have my bed pad, which will be my dirty area, because as we know, we would never put linen, even though it's dirty, on the floor. I do put it on the patient's chair. I'm now ready to make the closed bed. As I carried the linen in, did you notice I did not have it up against me because I did not want to get it dirty. What I'm going to do next is I'm going to raise the bed in the higher position, a position that is comfortable for me so I'm not bending and I won't hurt my back for this procedure. You would like the bed at a comfortable height where you don't have a lot of bending to do. And for my height, this is a comfortable position. So what I would like to do is to remove the old linen. I do know this situation. I do not need to wear gloves. If you ever are suspecting that the linen could be wet, you would always want to protect yourself and wear gloves. However, for this situation, I don't need to wear gloves, and I do know the linen is completely dry. The first thing I'm going to do is very carefully remove the top blanket, because we are going to use the top blanket. It is considered clean, so what I will do once I folded it up, I will put it on the patient's chair. I will then now continue removing the dirty laundry. As I remove it, I'm rolling it up onto itself. Since this is dirty, I am not putting it close to me. I now put it on my dirty surface where I have the bed pad. Lastly, I will remove the pillowcase from the pillow. The pillow will be reused, and I will put that on a clean surface, which is the patient's nightstand. I am now ready to proceed with the procedure and make a closed bed. I am now ready to make the closed bed. The first article I will apply, and it is in order with my linen, is the bottom sheet, which is fitted. When you open up your sheets, you do want to be very gentle and you want to be careful, because you don't want to shake any of your linen and cause a lot of movement within the air, because we do know germs can be transmitted that way. It's also very important on your bottom sheet to try to get out as many wrinkles as you can, because many times you will see these wrinkles in your patient's skin. I put the first corner in. I'm now putting the second corner in. Before I move over to the other side, I am tucking the bottom sheet in. I now have all the corners. I'm pulling the middle of my sheet down just to get rid of any of the extra wrinkles. Okay? I am now done with the fitted bottom sheet. The next step that I will do is to put the bed pad on. And again, my linen is in order, so my next article is the bed pad. An important part with the bed pad, there's actually two important steps, is the plastic side needs to face down. And the other important part is to try to put the bed pad where the patient's pelvic area is. The nice thing also with the bed pad is we can also use this when we have to move the patient. So the bed pad is now applied. What my next step is, I will be applying the top sheet, which again is in order. With the top sheet, it is important to put the seam side up. And as I make it and make the cuff, you will understand why the seam side for your top sheet needs to be up. And again, like the bottom sheet is, you do want to be careful with it and not to shake the linen and to disrupt the airflow. Here's the top. I feel the seam, and it will be seam side up. Another part of making the bed is you also want to make sure your linen is even on each side of the bed. You don't want to have more linen on one side than the other side. You also don't want to have a little bit of linen hanging at the top of the bed and a lot of the linen on the lower part of the bed. And it really just takes practice. The more you do it, the easier it becomes. I'm also putting the top sheet, as you noticed, right up to the edge of the mattress. And again, like the bottom sheet, you would also like to get as many of the wrinkles out that you can. I now have the top sheet on, and you can feel with your finger the seam side is up. I am now ready to put on the resident or the patient's blanket. I assess my top sheet. It looks even on this side from the top to the bottom. On this side, it looks fairly even. So I am now ready to put the blanket on, which I have over on my clean chair. And again, with the blanket, you don't want to shake it. With the blanket, you do put it on with the seam side down. If you notice, I am putting the blanket approximately 4 to 6 inches lower than the top sheet. And I will explain the reason why as soon as I'm done putting the blanket on. This blanket is nice. It's an all cotton blanket for your patients. And it also has an actual line going up through the center, so that does help you guide the placement of it. So the blanket is on. Before I tuck in the bottom and make the mitered corner, I do want to get the cuff. I now take my top sheet, I roll it, turn it down, and now you have no seam that will actually be up against the patient's chin. So when this is rubbing on the patient, there won't be any irritation. That is why when you apply the top sheet, you do have the seam side up. When you make your cuff, there is no seam. And that is the top part of your clothes ready to make the mitered corner. The purpose of the mitered corner is to make it a well-made bed that doesn't easily become undone for your patient or resident. One of the first steps in making a mitered corner is I like putting my left hand underneath the mattress and I just have better control. You are going to take your bottom sheets and blanket together and you're going to tuck it into the bottom of your mattress and just swoop your arm through and have the linen hanging. Once you do that part, you then come down about a good foot to a foot and a half, and you're going to pick up your sheet along with your blanket, and you're going to make a 45-degree angle. And you would like this to be smooth. The smoother that this is, the better mitered corner you do have. So this is smooth. I have a nice 45-degree angle, and I take the rest of the linen and I tuck it in. After I tuck it in, I then let it hang, and you can see the very nice mitered corner. I am now going to demonstrate the mitered corner on the other side of the bed. Again, I lift my sheet up, I put my right hand underneath the mattress to lift the mattress up. I then take the sheet and the blanket at the foot of the bed and swoop and tuck it in, and leave my blanket and my top sheet hanging. I then again come down about a foot to a foot and a half. Okay, I have the sheet and the blanket. I come out, bring it up for that 45-degree angle. Sometimes to make that smooth angle, you may need to use your hand to form the smooth angle. Then again, I tuck it in. Then I let this hang, and you have a nice mitered corner. After I finished my mitered corners, I will put a pleat on the bed, and you can either do it horizontal or vertical. And the reason for the pleat is when your patient or resident gets into the bed, it does make it more comfortable and gives more room for their feet and their toes. To me, there's nothing worse than getting into a bed and then your toes are too tight and it's very difficult to move. And really all you need to do is gently just grab on the blanket and the top sheet and make your pleat. And again, it doesn't matter in which direction that you make your pleat, okay? It could be vertical, or here's a horizontal pleat. The last step that I will do in making the closed bed is to put on the pillowcase. I have my pillow and I have my pillowcase, which is the last item of my laundry. And again, you do want to be careful and you don't want to do a lot of shaking. What I like to do is to take the pillowcase, I turn it inside out, put my hands inside the pillowcase, and I grab onto the corners. You can see how I have the corners here. I then will grab onto the corners of the pillow. And very gently, without a lot of rapid movement, I put on the pillowcase. And again, as all linen, you do try to get out as much of the wrinkles as you can. We do like to keep the open part of the pillowcase away from the door. And the reason for that is that there is a theory that a lot of the germs, as people walk in the hallway, can blow into the room. And they won't go into the pillow as long as the open end of the pillowcase is away from the door. We have a door to my left, and I will close the opening of the pillowcase and put it at the top of the bed. That is the skill of making a closed bed. I would just like to show you one more type of bed. When you do have a closed bed, and let's say you've got to call a patient or a resident is coming up, I'm going to make the bed more inviting and turn it into an open bed. All you have to do is take a hold of your cuff, bring it down a little bit past the foot of the bed, and fan fold it over. Your mitered corner is still intact. And there is your open bed. It is all ready for your patient. I have the call light. I will pin it to the bed. And there is a nice inviting bed for your patient or resident who is coming. I will lower the bed. We always need to remember to keep the bed in low position. I have now completed the skill of making a closed bed, which I did turn into an open bed. As I perform any skill or procedure, I do take pride in whatever I do. I now will take my dirty laundry, gather it up, keep it away from me, and then take it out into the dirty hamper, which will be in the hallway. I hope you had as much fun as I had with this skill of making a closed bed, which I did turn into an open bed.